Okay, so it is Monday night. We are planning to go through with our precious little girl's surgery here on Wednesday morning. So it's, it's a difficult time. It's a little bit sad, a little bit gloomy, but we're trying to keep upbeat, trying to think about some positive outcomes, trying to stay focused on the drive home after the successful surgery, how relieved we'll be, at least to get that stage completed. Honestly, it's hard to believe that this is happening again. Of course, it's a risk with any cancer that it's gonna come back, but I was surprised at how quickly this all unfolded. Less than a year and it's back, particularly because the results were so encouraging last year. Supposedly clean margins, low mitotic count. It seemed like we had a success story in our hands, and here we are 10 months later, approaching 11 months later, and it's going to happen again. So here we go in July. The heat and the difficulty that it poses for her, the intense panting in the car, that's just so harsh for her in general, but especially when you factor in the upcoming surgery. That is a big concern. And the clinic that we're going to, actually it's more an animal hospital that we're going to be taking her, is well over an hour away, maybe close to an hour and a half depending on the traffic. So that adds to the difficulty. It's a long car ride, and if you've seen any of our other videos, sometimes the way that she pants so intensely, that is what she'll be doing the entire car ride. Hey there, hey big guy. She'll be panting non-stop at 100 miles an hour. She'll be panting faster than we're driving, and that's obviously not good for her throat before they have to intubate her for surgery. It also drains her energy. She probably starts to overheat from stress, so it's a big concern, but we'll have to do the best we can with that. We pre-chill the car as much as possible before we get going. It's just a difficult situation. I don't know, it's a pretty flat video because honestly I think we're a little bit drained. I think I've maybe lost a little bit of the stress simply because I've been researching so intensely for hours and hours every day about what the right strategy is in this case when dealing with a recurrent soft tissue sarcoma, especially a liposarcoma, what exactly we're supposed to do, what the odds are by proceeding with a certain plan, and no matter what, it seems like surgery is absolutely mandatory. We're going to be proceeding with the surgery, and then we'll have some decisions to make. Most likely we'll be proceeding with some form of radiation therapy. Whether that's going to be 3 times a week for 4 weeks. Yes, good boy. You stay here, okay? Whether that's a hypofractionated version of radiation therapy, which would be probably once a week for 4 weeks, which has a lower chance of success in terms of a long-term cure, and also may have some slightly increased risks for late effects such as damage to the bone structure, tissue fibrosis, things that are relatively unpleasant. But at the same time, given her intense panting and the summer heat and just the general risks of anesthesia with a French Bulldog, I'm not sure that 3 times a week for 4 weeks is a realistic option. And there's always, of course, if we decide after this surgery that more anesthesia is just beyond our risk tolerance, we can always opt to go for metronomic chemotherapy, which, according to some small studies, and if you've watched my videos previously, you know that all the studies that I'm looking through, it's frustrating. They're just such small sample sizes, so it's really hard to say, oh, this has a great success rate. And after 2 years, 65% have achieved local control of their tumor. That sounds great, except when you look at it and you see that, it's a sample of 33 dogs or 41 dogs or whatever the case may be. So I don't know what we'll be doing, but one thing that is clear is we have to proceed with this surgery. So that's what we'll be doing. I'm so sorry. I can't even tell you how sorry I truly am. I know how much it's stressful. I know how much you're scared of it, and I really hate to put you through this, but we just have so much left to do. all of us as a family, and for you as well. You're just 8 years old, and I'm trying to balance that. And this is a real ethical dilemma. When you're dealing with someone else's life, what do you do? On the one hand, I really don't want to put her through this. It's so painful for me because I know how much she absolutely despises going to the vet. I shouldn't say despise, I don't get any animosity. Just how frightened she is about how frightened she is when it comes to going to the vet. It's clear that it's her greatest fear. And I despise putting her through that. I really wish that there was another way. But, when I'm talking about those ethical dilemmas at the same time, as I said, she's 8 years old. It's a soft tissue sarcoma on her shoulder. Actually, it's just behind the shoulder blade. It's not even making contact with the bone, which is a very important positive feature for a good prognosis. And so I cannot in good conscience say, you know what, I'm going to take I was talking to my wife about this, a book that was very influential on me when I was young, Of Mice and Men. I can't Lenny her, this is just not that kind of situation. I think there's too much, I think the opportunity for a cure, or I shouldn't say a cure, as I said in the previous video, when you're talking about cancer, I'm not sure that it's really the right statement because there's always a risk of recurrence. So I think there's a very good chance of at least a significant delay in the progression of this disease. And so if we remove this tumor and we do some kind of adjuvant therapy, such as most likely radiation therapy, which I really am not eager to pursue with all of the anesthetic risks, but that seems to be something that would give her the best chance at a long-term positive outcome. Or even metronomic chemotherapy after surgery. This would give her a very good chance at a good quality of life. And what do we mean by good quality of life? Well, that's why we're refusing those wide margin excisions. That was what was first proposed as the ultimate cure, which would involve potentially even a full leg amputation. That, I think, when you talk about the ethical dilemma, I think is just too much. But I believe that we have a chance here, and we have to try for her sake. I'm trying to think purely for her own best interest, but I have to admit there's also a selfish motivation, which is I'm not ready to say goodbye to her. She's a critical part of our life. Yeah, you're just at the center of our life. We can't just say goodbye to you, but at the same time, I don't think I'm being selfish here because she deserves to have more time. I think we're being conservative, we're being careful. We're going to be strict with our discussion when we meet the surgeon prior to surgery that we don't want adventurism, we don't want heroic surgical efforts to neutralize this disease. We're going to take a balanced approach, which is a very limited surgery that has virtually no risk on her quality of life. So nothing that would interfere with, nothing that would start shaving the bone of her shoulder or anything like that. But at the same time, just as much tissue as can be reasonably removed without any kind of significant impact on her mobility. And then we will roll, I hate to say it this way, but we will roll the dice with the radiation therapy and hope that that knocks out enough of the remaining cancer cells to delay this disease for a very long time. So we'll have to see how that goes. But I think that's the course of action that I'm not even sure if I'd call it the right course of action. I think it's the only course of action that we can take. Either option is unpleasant. That's the reality. We're really between a rock and a hard place. On the one hand, we put her through some harsh medical procedures that are just awful, and we really don't wish that on her. We really don't want her to experience that. But on the other hand, we just condemn her to an early death where she almost certainly will not see her 9th birthday, and she's just too young. I can't accept that, and I don't think it's right for her. I I don't think it's right to just let her life end so quickly. Hey, what are you eating? Stop that. I don't want a medical emergency for you as well. This is not the week for that, okay? So, here we are, getting ready for surgery in 2 days, all over again. Hey, big guy, I know you're going to have to be away from Sonora for a day, huh? And you're going to have to be confined. We're going to have to segregate these two. It's going to be a long recovery, probably about 2 weeks of strict separation and crate rest. And hopefully in about 2 weeks, the incision will have fully scarred over, and then we have 2 weeks of cautious care before we begin radiation. And that's about it. I have some big plans, I think, for her. I would like to, of course, do some traveling, go back to the bridge, go back to Arashiyama, do some walks in the park, do some more Kitano Tenmangu, maybe see some new things, who knows, maybe even in the spring we could take a drive to Mount Fuji, although I feel bad. I think car rides are just stressful. She doesn't enjoy them that much. And something like Mount Fuji would be meaningless for her. That would be meaningful for us to get to see them at Mount Fuji, take some nice photos with them with Mount Fuji in the background. But unfortunately, they're not really... Mommy, come here. Come here. What are you doing? They're not really attentive to those kind of distant sights. They would likely just be sniffing the grass immediately in front of them, and that's a very healthy mindset for these guys. They are focused on the moment. They're focused on what's actually right in front of them. And so, going to Mount Fuji would probably... Whoa, what is that? Whoa. Hey, what do you think you're doing? Oh my goodness. A huge clump here. That's dangerous. You're going to go to surgery tomorrow. We're going to look like complete fools. Trying to take care of your cancer, and we managed to let you choke on something. No. Something like Mount Fuji, I think, would be meaningless for them. I think they'd much rather just go to the same old park right down the street. That doesn't take much. Doesn't take much time. A 5-hour drive to get to some mountain in the distance that they don't even look at. I think it's just not fair for them. But if we have the ability, if the weather's right, it might be nice to do it. If we find a nice park there, it's still something different, and who knows, maybe they would actually take a look at it. So we have big plans for that. Yeah, we have big plans. Yes, we're gonna try, okay? And come here. Come sit closer. Yeah, good girl. Hold on, not yet. We have lots of big plans. Sit, not yet, sorry. Can you sit? Not yet. Hold on. Okay, hold on. So, I would like to take more time with her on the couch like this to make some videos. And you too, don't worry, you can be a big guy. We'll make some videos, all three of us, okay? We'll talk about some philosophy. That's actually in my spare time when I'm not researching medical issues for my dogs. I am actually a philosophy professor, and so I would love to talk about some ethical, philosophical questions and bring these dogs into the video. See what their point of view is. See if we can interpret their facial expressions and how they react to my questions. And we'll get some answers to some fundamental questions, like what is the meaning of life? What's the right thing to do in certain circumstances? What is the nature of reality? What is the nature of time? Does time exist? Is it just a construct in our minds? Let's see what the French Bulldogs have to say about that. Huh? So let's start that. We'll do a video podcast, the three of us. Okay? We'll do a French Bulldogs and philosophy video podcast. But before we can start that, we have a harsh summer with some surgery and radiation treatment. But just like all good shows, we'll be starting in the fall. Huh? So let's start preparing. That's the first plug. That's going to be our first plug for the upcoming show this fall, which is going to be French Bulldogs and philosophy. And you heard it here first. We'll be starting that once our precious girl here gets through her surgery and radiation and is back up to full strength. We're going to go ahead and tackle some of the important philosophical questions in life. So that is it for now. No, down. Get down, that's dangerous. He's got a back problem. The last thing we need, I can't believe I didn't pay attention to that. I let him jump up. That's really bad for your back. We can't handle any more crises right now, so that is not something that we can do. No. Be careful. So, to wrap up, She's just about ready for surgery. She had her shower. We used some chlorhexidrine shampoo on her. My wife put the chlorhexidrine shampoo on her to make sure that her skin is healthy for surgery. And we're gonna take it easy. We'll do another short video like this tomorrow. And I think that's about it. We're gonna get going. So that's it. Thank you for watching. Take care, everyone. Come back here. Hey, come here. Come here. Get back on the video. Come here, guys. What are you doing in there? Come here. Come here, guys. Come here. Come here. What are you doing? Whoa, 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 whoa. Okay, that's dangerous.